Hi, I'm Dr. Ron Miller of CashBasedPhysiotherapy.org, and today we're going to go over the 5 things that you must do or you must know about before you open up a cash-based clinic. Okay, so number one thing that I recommend is you have to be the expert. You have to be the best. You have to have advanced training because you're going to have to be able to show better outcomes and fewer visits and more cost-effective than standard care. So in just a broad term, you have to show better results compared to standard care. Now, not only will you just see the common patient that sees the value in your service and get them better in 1 to 3 visits, but you're also going to see complex cases. You're going to see the people that have failed multiple treatment approaches already. So you have to be an expert clinician so you can treat these complex patients. So the first thing is you have to be the expert. You have to be the best. Number 2 is you have to learn how to sell. Now, when you open up a business and you're in a proof of concept practice, or whether you really know it or not, you're now an entrepreneur when you do open up a new business or a cash-based clinic, that the number one thing that you have to focus on is sales. You have to learn how to sell. In a new business, no sales equals no revenue, equals no profit, equals pretty soon no business. So my recommendation for a new practice or any new business is you have to learn how to sell. Okay. Number 3 is going to be start with the end in mind. See your vision for your business and see your personal goals and clearly identify them, whether a year out, 2 years, or 5 years out. Identify your vision and your goals and start designing your plan backwards from that. I made the mistake when I first started out that I was just like, I want to make $100,000 a year, and I'm going to charge $75 a visit. And I just started seeing patients at individual sessions. And after a couple months, and you take a step back and you look at your goals and am I on pace to get this? I was way off. So what I recommend to cash-based clinics, especially new ones, is establish your goals and your vision, and then work back from there and work out a plan to attain your goals with them clearly in mind and focus. So start with the end in mind and work your way back. Now, number 4 is marketing. We have to learn how to market. And I don't want this video to go too long because, but I'm gonna tell you a quick story. I recently met with a venture capitalist who's very successful. He's an entrepreneur and businessman. He has his own venture capital firm here around Orlando. And I met with him for lunch and I was picking his brain and we were running some strategies by each other and we were discussing business. And I found out that he actually invested in a local wellness practice that was ran by some acupuncturists and chiropractors. And he made this comment that I didn't really agree with, but he said, or their business model was, we want patients for life. Now, I don't agree with that, and that's going against everything or every principle that I thought about when I started my practice. And he didn't really like that whenever I made that comment back, that I don't agree with that at all, because I feel that all he's doing is just managing a diagnosis and he's maintaining some symptoms throughout a long period of time, and that's doing a disservice to his patients. Now, that was his business model because he has a very business mindset. Now, the reason why I started Pursuit Physiotherapy is because I wanted to solve the root cause of the problem. I wanted to get patients pain-free, and I don't want them coming to see me 8 months down the line or twice a week for a year. My goal is to really solve the root cause of their problem and get them pain-free. Now, what he came back to me with was, if I want to keep that principle of truly solving the root cause and getting patients better quicker, that I'm going to have a marketing problem. And this is the point that I'm trying to get at. We need to learn how to market our services, because if we are going to hold true to this and really try to be the experts in musculoskeletal injuries and get patients better faster than standard care, we're not going to have those patients for life. We may develop other strategies to get people to come back or to refer or to join this type of program, but I don't want a patient for life because I don't want to manage some symptoms. I want to solve the problem that's causing their pain. And if your practice is going to keep that mentality or that principle, to guide or to truly treat patients and help them and do the best for the patient, that you have to learn how to market, plain and simple, because you're going to have faster turnover with patients. So you have to keep your marketing funnel kind of constantly filled. Okay, so number 4 is marketing, and we have to learn how to market our services. Number 5 is, what better time to start a cash-based physical therapy practice than now? So we're going through healthcare reform, and we don't really know where physical therapy is going to be on the totem pole of healthcare at some point with healthcare reform. We already have like plenty of research that is establishing the value of direct access to PT services. How much more research has to come out to show that we're cost effective? You know, how much more research that has to come out that shows that physical therapy shows short-term and long-term outcomes as compared to surgery and other ways of treating. Whether your patients know this or not, in the future of healthcare, they're going to be more responsible for the cost and the out-of-pocket costs of their treatment now. So what better way to step in with a cash-based physical therapy practice that maybe you'll be able to help someone out for $500 versus standard care that's going to be $1,500 or maybe like $2,000. So what better time than now to open up a cash-based clinic and really have us step up and be the experts in musculoskeletal injuries? And the last thing is really kind of like a side set to number 5 is prepared to work hard. Opening up practice and opening up a business is not easy. Honestly, it's been the hardest thing that I've ever done in my life. So if you're thinking about opening up a cash-based clinic, be prepared to work hard for the first couple of years, because it's literally, you know, you have to start working 24/7 almost to get your business thriving and up and running. So forget some of the other marketing stuff and things that make it sound so glorious and easy. But marketing's hard, and you're always going to experience problems as a new business owner. So those are my 5 strategies or things that you must know before opening a cash-based clinic. If you like this video, please share it on Facebook or share it on YouTube. If you have any comments or concerns, please, you can fill it out in the comment box below. I'll do my best to answer any questions that you may have within the hour. And I just want to say thank you very much for your time. You can click on the link to Facebook or to the website below. And I hope you found this as a valuable learning experience. And thanks again for your time.